Okay, I'll make that 10 o'clock, so I'll make a start. Morning, everyone. There we go. My computer tells me it's 10 o'clock. It's good to see you all. Disappointed, obviously, that it's not in person. However, it'd be great. I think the likelihood is that our next meeting will actually be in County Hall. So I'm awaiting that one. That'll be brilliant. It's just so you're aware. I think many of you know that I'm not firing all cylinders at the moment, and I think it'd be great if I could just have your support during this meeting. I just remind you again that this is a policy meeting, so do try and steer your questions and comments towards building up policies, and not so much on the scrutiny side of things. With that in mind, let's crack on. And Fiona, may I have apologies, please?
Thank you, Chairman. Yes, Rebecca Knox and Darryl Turner.
Okay, fabulous. May I have any declarations of interest? Fantastic. I take it by the silence that there is no declarations of interest. And so agenda item 3, I think it's just worth me mentioning that there has been quite a lot of correspondence from Swanage and the ambulance car. I think we've all been inundated with emails, and rightly so. Members of the public are very passionate about it. What I will just say, and just bear with me whilst I bring up my text. I think I'm very happy to look at the ambulance car, and I'm happy for it to come to the committee in some sort of guise, and whether or not we have a subcommittee, etc. I'm not quite sure what that's going to look like yet, and that'll be made in decision with the cabinet member. But I think what we need to be doing is we need to be really clear that I'm not going to bring this to the committee until the CCG will actually be launching their consultation. Like others, Dorset Council will be a consultee of the CCG, but today there's nothing to consider as they haven't gone out to consultation. I have, however, had it on good assurance that the CCG have concern that there will be a consultation, and I can confirm as well that the CCG are not that pending the outcome of the consultation there'll be no change to the current service. So hopefully that brings some clarity to people. Again, I'm happy to have it in. I'm not quite sure what it'll look like. Maybe a subcommittee. I'm not quite sure, but I think that will hopefully just soothe some people's fears. That and we have to be very clear about our role as well. We're a consultee, and we're not the people that decide on the fate of the ambulance car, if it even comes to if it even comes to consultation. There we go. Fiona, where are we now? Let's move on. So I have agenda item 4. Are there any questions from members?
No, Chairman, no questions received.
Fabulous. Let's go to agenda item.
Chairman.
Yes. Is that Beryl? Councillor Izzard, how are you doing?
Yes, it is. Sorry. Yes, just apologies for from Ryan Holloway. He's at a conference over Bournemouth way, and he's hoping to get back to join the meeting shortly. So apologies from him for lateness. And just to mention about the hospital car, yes, I've been inundated, and I mean I'm from Purbeck, and I probably noticed that Councillor Bill Trite and Gary Sattle are in on this meeting. And yes, it has been a very passionate thing about the Purbeck Rapid Response car. And you know, I did mention that I'd perhaps request that this committee could have a task and finish group in preparation for the consultation, and wondered whether that would be consideration that we could make in readiness for when the consultation comes up, because I think Swanage are very, very afraid that they are going to pounce this on the community and say, this is the proposal, this is what we're doing, and we've got no chance to be consulted. And we do need to listen to our town and parish councils about their concerns and worries, and this is a big worry for them. So I'm sorry to bring it up again, Andrew, and I'm sorry.
No, it's fine.
I mean, just to consider whether in the interim between our meetings, this consultation may come up, and we might then miss actually the chance of having a debate about it.
No, okay. So Beryl, no, I get what you're saying, and I'm happy to what we'll do is we'll decide amongst the members and the cabinet member. It'll be a round robin email, but I think it may be a task and finish group. I'm not quite sure. It may be a subcommittee. I think it really depends on how long the consultation is and actually what they're going to be consulting on. But I think that my concern is, and I think we have to be very careful that we don't go down the route of predetermination, because otherwise that's in nobody's best interest, and actually that dilutes our views. So I'm not really prepared to take any more questions on the ambulance car until it actually comes out to consultation. I think we're gonna park that there. There you go, if you like the pun. But I do get that people are very passionate about it, and actually so am I, because this is primary care. This is when people are at their most vulnerable. So I'm happy just to wait until that consultation comes out, but we have a process in place, and it will be looked at. So there we go, Beryl.
Thank you very much. Thank you for listening to me. Thank you.
No, that's fine. That's okay, and hopefully that will calm some nerves for local residents as well. So let's go on to the updated Dorset Council plan. So I know a few members have had a workshop, and I know that the amazing Rebecca has facilitated that. Rebecca, would you like to introduce, please, and would you like to say introduce yourself as well? Thank you.
Morning, thank you, Chairman. Yes, thanks, members. I'm Rebecca Forrester. I'm a business partner in corporate services. Sorry, forgot for a moment where I work. Yes, if I can just give a few words of introduction to this item, that would be great. So, Cabinet requested that we update the council plan, particularly to focus on the pandemic. The plan, as you probably remember, was agreed shortly before the COVID pandemic struck last year and makes no mention of. So the specific request was to focus on updating with that in mind. You'll see from the report that the additions that have been made have been flagged in yellow just to try and make them easier to identify. And as Councillor Kirby said, we had an informal meeting of both overview committees at the end of July to look at the draft and work through the priorities. Two particular things that came out of that were that members were quite keen for the climate and ecological emergency priority to move from being what was originally a cross-cutting priority to being actually the first priority in the document. And that follows obviously a lot of work that's been done on the climate and ecological emergency strategy. The other request that came out was that the partnership section, which if you recall in the original document was separated out under each of the priorities, was brought together into one section. I think members' views, and correct me if I'm kind of misremembering this, but my understanding was that members felt that one of the very clear and strong lessons that has come out of the pandemic is about the impact of partnership and how organisations across all sectors have come together to really support our communities and our most vulnerable residents. So that's now formed its own section to try and give that more weight. I think that's all I really need to say, Chairman. I hope that the revised draft reflects the comments that were made at the workshop. The request is now today for any further comments before it's due to go to Cabinet in October. I'm happy to take any questions.
Thank you, Rebecca. That's very kind. Are there any questions for Rebecca or any comments on the plan? Because I've got a few, but go on, stick it in the chat. I go for Pauline. Councillor Batstone.
Thank you. It's comment that for me the most important part is going to be the synopsis, the thing we put in the public domain when we're trying to get publicity for this new plan. So that's where we need the major points made, that it's a very lengthy, very difficult to fight your way through document. That's going to be absolute key, that we have something that is easy for members of the public to read. So good luck to the communications team in working on that, and we look forward to reading it.
I actually had not concerns, but there are a few changes. Oh, sorry, Bridget, go for it.
Thank you, Chairman. Morning, everybody. I'm Bridget Downton. I'm head of the Chief Exec's office. Just wanted to respond to Councillor Batstone's point, if I may, Chairman. We will be producing, once Cabinet have agreed the wording of the plan, we will be producing a graphic, which I know isn't a real verb, but version, which will make it easier to read as a document, and easier to find your way around and to flow, because Councillor Batstone makes a very valid point. Also to say we will be doing, again, as we have with our current plan, a plan on a page as well to summarise the key points. So hopefully we'll have something that is a bit more accessible for people. Thank you, Chairman.
That's okay. Hope it's not too graphic, Bridget. There we go.
I hope so too.
Okay. My only points were I wasn't able to attend the workshop, but the one things I wanted to look at was, I think in a way, my points were that it's almost as if we've done this slightly back to front, and I've had a conversation with the leader and the deputy leader on this, and I think that although it's a very good document, I think if we were to go to page 11, it points out some of the issues that Dorset Council faces, and I don't think it adequately addresses quite all the points, or it's actually explicitly noted in the document. My feeling, although the members may feel slightly differently, is that one of our biggest issues facing Dorset Council is our demographics, and I think what we've done is we've nicely put our understanding Dorset, and we've listed quite a few of our issues. So some of them are around our demographics of an ageing population, with our younger people and economically active disappearing off, and then down in our economy and infrastructure, we mentioned how our house prices and the affordability in Dorset is one of the worst, and I don't think that's adequately reflected in the document of how we're going to tackle our demographic issues, and I think that would be. I think a bit more flesh around that would be fantastic. I think that's the polite way of doing it. I think that as a council, our issue is that we've got the graph of doom. So we've got our adult social care graph with the increase in cost. And if we continue down this route of our economically active disappearing out of Dorset, and I'm not quite sure why. I have an inkling as to why that may be. We need to address that, because otherwise it's a smaller and smaller population paying more and more, but also not having the people to be able to fulfil the roles and jobs in Dorset as well. So I'm going to pick on Rebecca. Would you be able to just talk to my point? I'll put you on the spot there. Do you think it's adequately noted in the plan?
It's certainly something we can do more work on, Chairman. I mean, the plan is the culmination of input from all of the directorates and services. So it is at the moment, obviously the point is to try and keep it an accurate reflection of what we're going to do, and some of those things are within our control and some of them aren't. Yep. But yes, certainly I can go back and talk to relevant officers and members, and where there is activity that is not currently accurately reflected, absolutely include that.
Yeah, I just think that otherwise in that first page we're listing all our issues with Dorset, and then the rest of the document doesn't actually reflect that address those issues, if you see what I'm saying. Les, Councillor Fry.
Yeah, thanks, Chair. I was just looking at that same page where you've got there on the top section with population where it talks about crime is generally low in Dorset, which is true, although antisocial behaviour and rural crime is a growing problem. Bearing in mind this document is going to be in existence for a little while, perhaps we would be better to say is an ongoing issue rather than a growing problem. Because if it does reduce, then we'll look silly saying it's a growing problem.
It's true. Les, whilst you're here, in the rest of the document, does it address, are there any further words to antisocial behaviour in the?
Yeah, I can't comment too much on that, Andrew.
Sorry, mate, I put you on the spot there, didn't I?
Yeah, that's fine. No,
we've been sort of saying that we've listed the issues in the sort of like in the introduction, but there's very little in terms of how we're going to solve them. So I think that for me would be the way forwards. Councillor David Taylor, David.
But just to come back to you, Chair, on that one, I think we need to list them, but as we are players in working in partnership, as has been already highlighted, working in partnership is the way we're going to resolve lots of our issues. It's good to identify that that's how we're going to resolve any of the crime and ASB issues, and they're not something that we can tackle on our own. I also liked what Pauline says and what Bridget said as well, and I think that all fits in nicely with there.
Yeah, cool. David.
Yeah, thank you, Chair, Speaker. I know I haven't answered Mr. question. The one thing that sticks out to me quite alarmingly is the ratio of skills to wage, because the fact is we are endorsed one of the lowest paid wages in the country regarding the skill set. So that means that a lot of this missing of our skills is probably because of the fact we can't actually support them with a decent wage. That might be an important point to take into this, because it is sadly missing. Yeah,
and I think that thank you for taking up that mantle, and this is where I was trying to push, is that we do have an issue with the amount of prospects and job roles in Dorset, and it mentions things like seasonal work is usually quite low paid as well, and what we want is we want people to have those opportunities, and if those opportunities don't exist in Dorset, then our economically active will go elsewhere, and I think that sort of increases the damage to our demographics, and we have these communities that are just not sustainable, and we have an aging population, and we have our aging villages, and you just think some of our villages are dying quite literally, and I don't think that makes us a particularly resilient county, and I think that increases the impact on our council services. So I think that's why I'm really passionate about redressing our demographics and keeping our older people healthier for longer, and using things like prevention at scale, and I just don't think that's adequately reflected in the council document. I'm not asking for a rewrite, quite the opposite, but I think we need to be braver in terms of things that we want to actually just highlight. This is our plan, and this is what we want to achieve, and I think that we can highlight that too.
Can I come into that, Chair? Say, as a young person from Sherborne, born and bred in Dorset, I noticed and saw through this entire problem from the early 70s, the 80s, to the 90s. It's a situation I see time and time again spreading through Dorset. The wealthy move in, the poor move out, and that's where I think we could address it a lot more harder than we're actually doing, because we do actually need to keep our youth here to support our aging population. Thank you for letting me speak, by the way. Thank you.
Yeah, it's fine. I won't get so political. I'm not bothered about the rich or the poor, but I think you've highlighted it quite well. I think we need to, we talk about the affordable housing, but actually, it's going to need more than just the affordable. My view is we're going to need more than just affordable housing to be able to keep our economically active there, and how are we as a council supporting our key workers? And I know that I'm probably get told off for this, but key workers has been something that it has been bandied around a lot recently, but we really need to ensure that our skilled key workers, such as our doctors, our nurses, and our police officers and our teachers, can actually live in Dorset. Otherwise, it just becomes a self-fulfilling prophecy, and this positive feedback effect of actually having an absolute brain drain in Dorset, and then more and more being piled onto to less and less. So yeah, I'm happy. So I think if we could get that over to Cabinet and say, can we have a look at this?
Very much.
Can we expand on that? That would be really good. If there's no further comments, because I know that this has been done a little bit, we'll move on. So is everyone happy with those comments going through? So that's a yes.
Yes, please.
Yeah, there we go. All right, I'll be quiet now, and I'll let someone else speak. So agenda item 6, which is a birth to settled adulthood review and next steps. So you go, so nice and juicy to get in. Sarah Jane, SJ, go for it. You're in County Hall today, aren't you?
I am. Yeah. Good morning, Councillor Kirby. Good morning, everyone.
Morning.
I'm Sarah Jane Smedmore. I'm the Corporate Director for Care and Protection Children's Services. Thank you very much for having us along here this morning to present this report. I'm also joined by Steve Vivers, who is the Corporate Director within Adults, and we do have Elizabeth with us as well, who has been the author of this report and has been doing this work for us. So what I'm going to do is I'm just going to set the scene, and Steve will come in and just make sure that we're joining all of our dots together between children and adults, which as you read the report, you'll see that that's the ambition here, is to make sure for our children as they grow and they grow into young people and into adults, that they receive a seamless and timely service from us. So you'll see from the report that we haven't been in the place that we would want to be regarding particularly preparation for adulthood and transitions for our children who have disabilities, for our children who have special educational needs, and for our children in our own care as well, who we know need to transition and still require support from ourselves in children's services and from adult services as they grow. What we've known for some time and what families are telling us, what children are telling us, and Dorset Parent Carer Council have been really helpful and instrumental in making sure that we're keeping a focus where we need to, is that our transition planning hasn't always been timely, and that the information that we share hasn't always been as clear as it can be. So as a parent thinking about what are the next steps for my child, and particularly if they've had a lot of support, and quite rightly, in their childhood as they grow into adulthood, how will that support look? How will it be delivered? And where will their child and their young person make sure that they've got access to all of the people and all of the support that they need? So we've been really thinking about that join up and that ambition. And our ambition, as you can see, is set out in the paper. So we've been able to really take a look at who are our children, who are our families, understand which resources are available to us, also really understand that as a local authority, legislation, we have responsibilities under the Children Act for care and protection of our children, under the Children and Families Act for special educational needs and for education for our children, and under the Care Act for our adults. So all three of those are statutory responsibilities that we have as a local authority, and we hold those statutory responsibilities in different directorates. But that shouldn't be relevant to our children and our families and our adults. And our ambition is very clearly that when receiving services for children into adulthood from ourselves at Dorset Council, that families don't need to realise that they have a very seamless service from us, that we speak with one voice and we make sure that we are right alongside them to ensure that the right plan is there for their child and their adult. So, Steve, I don't know if you wanted to come in there and just say anything further before we just come to what we're asking really from committee this morning.
So thanks, Sarah Jane. No, that was fabulous introductions to what's going on and really sums up, I think, from both directors, both children and adults. As Sarah Jane has said, we have a shared ambition in this. We both understand that actually this is a really important task to make sure that we get right for all of the right reasons, to make sure that it doesn't feel like a false boundary or as it's sometimes described, a cliff edge between children's services and adults. We want to make sure that that is not a position that our young people going through transitions experience, and that we are really focusing on those things that are really important for people: education, employment, real lives, jobs, housing, relationships. Those are all of the things that we're holding really close to us as we start to go through this piece of work, and recognizing that there's both some things that we need to do in the short term, but also there's things that we need to put into place for the medium to longer term as well, to make sure that it is sustainable and ready going forwards. So thank you, Sarah Jane. No, really good summary.
Thank you, Steve. So what our paper details is really those next steps. So we've done the exploration, we've done the discovery phase, and what we're bringing to you is a proposition really and recommendations as to how we go forward. And you'll notice in our paper, it's deliberately, the first recommendation is around how we deliver that ambition, and hearts and minds is really important, not just for our children and families, but for our staff and for our partners to really feel invested in that. In our ambition really, so that we are speaking with one voice. So what you'll see is there's a recommendation around a governance structure, and underneath that governance structure we have different work streams identified there really well by Steve, thinking about all of the things that we need to give sight to for our children and adults. And also there's a second recommendation, and just to update you, we've already started moving at some pace, because pace is what's required here, on that second recommendation, where we've identified children who are needing 93 children and young people who are needing support, needing that assessment, and already successfully we've got that number down by at least 30. So we've started working at pace. So just some reassurance to everybody that we're not waiting for the things that we can do immediately, but really I hope today that following discussion that you will support us with this ambition and support us in the governance. We're really thinking about between now and April. So when we're talking about wanting to move at pace, we want to be ready by April to deliver our services together in whatever way we get to thinking that we need to do that. And along the way, think about hearts and minds, training for our staff, financial implications, continuing with our stakeholder engagement. That's really important to us. And that governance structure will allow us to do that. And then the opportunity to keep reporting back on progress as well. So thank you, Chair. That's the end of my summary.
No, thank you, SJ, and thank you, Steve, and thank you, Elizabeth. That's it's been really good. It's nice to have it. I get hundreds of emails per year on this very issue, so it's nice to see it being addressed. I've got Councillor Tony Coombs and I've got Councillor Stella Jones. Tony.
Good morning, Chairman.
Morning.
I am so pleased to see this report coming forward. As a previous portfolio holder for children under the old regime, this is something that I have been pushing for well over a decade, and it was always in the too difficult pile, and we couldn't get this group to talk to that group. So to see everyone come together is absolutely brilliant. I'm so pleased, and I'm more than happy to propose the recommendation. The only question that I have got on it, one of the key issues in young people's mental health, the CAM service offer a lot of emotional support for young people's mental health, but as soon as they transfer up into adult services, it becomes a clinical diagnosis, and there is that what used to be a cliff edge in that emotional support. I just wonder if someone could just talk a little bit more about how you see that changing.
I'm happy to take that one, Sarah Jane, if you want. Good morning, Councillor. Yes, we operate, as Sarah Jane's really eloquently set out, within a sort of really complex legal and kind of jurisdictionary boundary. What we're trying to do as part of this piece of work is to blur those edges, to make it sort of feel like a very seamless position. One of my very early tasks when I came into adult social care about 6 months ago was around a mental health social care review. As you may be aware, that our adult mental health teams are co-located with our clinical practitioners. So we have social workers and psychologists, psychiatrists and mental health nurses all co-located. Part of the review work has looked at exactly that, about the prioritisation work that is needed to make sure that we pick up people who would be on the periphery, so would be eligible for services under CAMS but would not be eligible for services under adult services. And what we're looking at is a range of preventative measures, and we describe them as a kind of community-led journey measures to make sure that we can pick those people up. So it is cited, not particularly within this piece of work, but it is cited within the adult piece of work at the where we are doing some changes within the way that we operate. So we are trying to sort of make all of those pathways through from children into adults as seamless as possible.
That's really good news. Thank you.
Fab. I've got Councillor Stella Jones next.
Yeah, I welcome this document. It was obviously needed when we think we've got 93 outstanding cases and another 77 who are deferred from finance. But what concerns me most is on 124, where there are 400 children and young people waiting for specialist school placements and assessments are not taking place. Now, we're looking at the 93 cases, which is good, but you say that that may not enable early identification or assessment of others. Early identification and assessment is essential for the youngsters and for the council as well to know where we're going. Can you let me know when we are likely to start looking at assessments again and the identification of these other 400 young children?
Who wants to say that one? I'll pick on SJ.
Yeah, Councillor, I'm happy to do that. And I understand that Vic Verma, who's our Director of Education, is also on the call. So it might be that Vic might just want to join if any information which
you must still pass that to Vic. Go on then, SJ.
I can start, and I know Vic will come in if I miss any opportunities. So assessment for our children with special educational needs and disability is an ongoing process for us, and we have a graduated response to be able to really work with families, work with education providers, work with our children to think about what it is that's the best support for them, and to make sure that those plans are moving forward. Vic, did you want to just say any more about Councillor Jones's question around the 400 children that Elizabeth has identified, just to give more detail?
Yes, I'll just need to find that in the paper, just so I've got the correct reference. So
it's 124.
Yeah, apologies, Councillor Jones. If you're able to repeat the question, I'll just
yeah, there's currently 400 children and young people waiting for specialist school placements, and further down it says you're going to look at the 93 cases but may not enable early identification or assessment of these 400.
So I think the 93 probably relates to the children that are awaiting assessment from adult services. So at the moment, there are a number of children who are in, for example, post-16 educational settings who are undertaking different qualifications, but may also be receiving some care as part of their settings. So there's discussions we've been having with adult services through our different governance panels around that referral process to adult services to support those children into kind of their next phase of adulthood, really beyond education. So that's an ongoing conversation we've been having with Steve's team about how we can clear essentially that waiting list of young people who are awaiting assessment in adult services, so that we can start thinking about their care planning beyond that. But just going back to kind of our wider policy around that, preparation for adulthood in SEN begins really at year 9 and year 10 for our children and young people, because quite often we can see at that age where the trajectory might require support from other services, and that's what we would undertake as part of an annual review process. And we're working with adult services on showing them that data and those cohorts of young people, so they can think about demand earlier into the system. But Steve, I don't know if you wanted to come in there.
Thanks, Rick. Yeah, I just put a RTS to sort of come back on this and just maybe finish it off from an adult's perspective. This is a absolutely fabulous question. It probably gets to the nub of the issue that probably children and younger people have experienced over the last, certainly probably by the sound of things, 10 years, if not longer than that. The lack of good communication between children and adults previously, and I do say that previously, I think we've really made leaps and bounds, and Sarah Jane absolutely reflected the fact that about 93 assessments is already down, I think down to 68 or 67 over the last maybe 8 weeks, 10 weeks of working in a different way. And Vic's right, it is about identification of those younger people, and being cited from an adult's perspective has really helped us start to sort of make sure that we can provide really good in-reach services to children. But that's what we want to build on. So are we doing it well enough at this point in time? Absolutely not. The remainder of those 69 individuals that were originally the 93, of all of those individuals that we wouldn't have historically started to help support. So there's people that might be maybe 16 or 15 or 14. Our ambition with this piece of work is to make sure that there's a seamless conversation. So our children's social work staff and our adult social work staff have exactly the same conversation as soon as people start to be thinking about transitioning from children's to adults. And that's the piece of work that is really going to pay dividends to us as an authority, but most importantly to those young people that are going through this change in their status that we see, but realistically isn't any different for them. So although this doesn't answer the question on the education, I think having sight across both adults and children will bring benefit to both directorates in really sort of planning and doing good planning for people to help them get what they want out of life, and us as a corporate parent, but also a funding body to make sure that we do that as well as we can for people.
Thank you. Can I just ask, do you maintain support after the age of 19?
Answering that from an adult's perspective, I have legal responsibility for anyone that has care and support needs post 18. Where the legislation changes ever so slightly is children's have some responsibility for people who have EHCP plans post 18, but I'll ask my colleagues with better knowledge of that to come in at this point in time and make sure that I'm not tripping over anything.
Thanks, Steve. I'm happy to come in there. So the SEN cohort of children and young people, the legislation covers children obviously from 0 all the way up to 25, so that's where the overlap is, obviously around that 19 to 25 cohort, where we focus much of our attention with colleagues in adults, and it's that fine balance of educational provision that needs to be put in place to support a child to achieve their educational outcomes, and then care needs, and where we're asking, I suppose, colleagues on individual cases to support us in children's with some of that cohort is where there are significant care needs that would need to be met through adult services. So that's where we need to work in that multi-agency way, and that's been a lot better certainly in the last year in terms of how we've started to identify those cohorts and intervene in particular cases. And now the work is to bring that much earlier to the younger cohorts.
Right. Thank you.
Stella, you are on fire today. That was good. Yeah, Esther, do you want to finish up that?
If I could just add to that, obviously, just an opportunity to remind us that we're corporate parents as well to some of these young people, and as corporate parents, we remain involved until 25 and beyond, as parents do. So between us all, we make sure we stay alongside.
Yeah,
thank you.
It's quite confusing on the overlap. Having the children with SEN up to the age of 25, our corporate responsibility for our corporate children's up to 25, and yet also adults obviously starting at 18, and then you've got children's looking after, in effect, 25-year-olds. Anyway, I digress. Councillor Tony Alford.
Thank you, Chairman, and good morning. I have two questions, if I'd be allowed to ask them, please, and unsurprisingly, I will start with question 1. And firstly, as a preamble, to say that I welcome this report, and I'd certainly be happy to second the recommendation. I suppose the overall way I think about this is, are we allocating enough resources, doing enough work to make all of this work? Because I think it's absolutely essential that it does work. And I had a look at the risk management section to see if it gave me any clues to officers thinking about whether these proposals will be successful. And we know that the risk assessment is high, but we don't know very much more. So I'm looking for some sort of confidence that we can deliver here. And if there isn't, or if there are issues about that level of confidence, exactly what they are.
So do you want me to go in first?
Yeah, go for it, Steve.
Thank you. Thank you for the question again, a good one. So on page 35, you'll see that we've got the timelines and the structure set out. So we have, as long as we seek and receiving approval today, we have a phase 1 process which is defined. What we've done at this point in time is assess that actually the experience, even for one individual going through from children's to adults, if it's poor, that's a high risk for us as a council. So therefore, we have defined it as a high risk at this point in time. Our defined stage will really map out those risk areas that we go through. So you'll see that we haven't put in the risk mitigation of those factors, because actually we want to test those out with the individuals that we are talking about. So what we will be happy to do is to come back with an updated risk assessment, I would say at the end of this calendar year, and be clearly saying this is where we've then mapped out those risks. This is the mitigating actions that we're taking from both a children's, an adults and collective perspective to address those risks and put into place. We have defined that there is a financial risk. I think we've indicated that on a section 6, the risk assessment at this point in time, the financial strategic priorities. Both adults and children, as you're well aware, as a council, we are under a significant financial strain because of the adults and children's budgets. We would have been remiss to not have included that actually as a cohort of individuals genuinely with fairly complex needs, we need to make sure that we are sighted on these individuals that are coming through and on our shared priority to make sure that we support them well, and how we support them from a financial point of view, as well as a good outcome perspective. I don't know if that answered your question, Councillor.
Well, I think the answer has been very interesting, and I suspect that it really is about, hold on, there'll be more information coming through as some of this activity gets put in train. So it does have the sound of something that perhaps members ought to be taking consideration of from time to time. Because I think there's a little bit of an open question at the moment, and in due course, perhaps it would be interesting to see how it gets closed off. Perhaps I can go on to question 2. And question 2 is about the voice of the young person making the transition. And there is a little sentence on page 27 which says, what is the experience and journey of a young person across the multi-agency partnership? Now, a perfectly reasonable question, but I do wonder who will be providing the input into the answer to that. And I do feel as though it does need to be the young person themselves. I don't know how the young person's contribution will be made, but it does seem to me in sections, for example, we talk about inspections and discovering things. Well, I do feel as though we should discover nothing new in a formal inspection because we should know about these things. I recognise, of course, that there are processes such as the EHCP, but it does seem to me that the EHCP has a particular purpose in life. And I think we are doing more here than anything that would be covered by the EHCP. So I'm interested in how we get knowledge of young people's views about these things that are important to them because it's about their life.
Yeah, if I could answer that, it's a really good question, Councillor, so thank you for that. We have to listen to our children's voices every day in every way, is what I'd say. So we do that through good social work, good support in schools. Schools are fantastic advocate for children, and we work particularly closely with our special schools who are able to help share their children's voices. But I think it's our practitioners who do that work and understand, have that conversation with our children, communicate with them in the best way possible and feed that back to us. So that's a very individual approach, and we see that through their great casework, through our own quality assurance and auditing, but also Dorset Parent Carer Council have just been fantastic really in staying alongside us, and obviously they're parents of children, so they're giving us their children's views, but within that as well, they allow their children's voices to come up through the conversations they have with us, and also for allowing us to speak with their children and to coordinate their children's voices, and also through our participation work. So we have a range of ways that we make sure that we're hearing our children's voices, but really keeping them central to the work, what's best for them, you know, and their parents know what's best for them, and we need to wrap around and just hear that and make sure we give the right support. So throughout all of this, we will make sure that children's voices and their parents are at the heart of what we're doing.
Okay,
Thank you for the
very
question.
helpful. That's very helpful. Thank you.
I think Councillor Kirby might have just left the meeting for a couple of moments. If people are happy, I'll ask for the next question, which I think might be.
Thank you. It's me. It's Councillor Taylor here, David Taylor. Thank you for this report. At long last, we're addressing the issues which have been so left out from our communities of children and adults in the last goodness knows how long. I'd like to come into the point though, as I sit on the foster selection panels of Dorset, it's imperative for us to understand that the future of the children is being guided every way, and I know that it is, because the fact of the work going between the 16 to 18 and the 18 to 25-year-olds is now becoming faster and better approach to what their needs are. Can you address this as in how do we connect up on page 35? I see business intelligence, transition operational and transition into adulthood. How are we fitting into that as the foster selection panels to understand that it is being looked after and going forward?
Thank you, Councillor Taylor. Could I respond to that question?
Thank you.
Please, thank you. A really good question. And obviously, our fostering family for our children in care are just crucial to make sure that we support our fostering family and also have the best possible care for our children. And in responding to the previous question, when I talk about hearing from parents, I mean parents and foster carers, because we know that our foster carers are a great advocate for our children. I will personally make sure that the fostering panel are cited on progress in the updates that we bring to the fostering panel and the conversations that we're able to have in those spaces. I'll bring those updates as they happen, really, and to take feedback to anything that we think would really feed into this. I know as a fostering panel, and Councillor Taylor, please correct me if I'm wrong, but that real focus to stay put. So for young people in our care, we really welcome foster carers who are able to keep caring for their children beyond 18, and we call that a stay and put arrangement. And the fostering panel are really helpful in helping us to identify those fostering families where we could really encourage that and really nurture that. So really welcome the interest from fostering panel, and I will make sure that we have those updates brought back as well.
And it is noted, thank you very much. It is absolutely noted that we are going forward and not backwards, just to let you know that we are impressed with what's going on as well. Thank you.
If I can just follow up, Councillor Taylor, with just to give you a practical demonstration of how adults and children are trying to work together to make this a really seamless experience. So earlier on this year, in May time, adults have a equivalent to fostering, which will be our shared lives scheme, which you might have been aware of. So what we've done is we've aligned our terms and conditions of shared lives carers to fostering parents, therefore making it for those individuals that do wish to continue looking after individuals post 18 and to operate under exactly the same framework, terms and conditions and experience. We've made sure that we are absolutely exactly aligned with children's services for things like training opportunities, paid holiday, bits going on. So we're really trying to think about all of those opportunities for people and making sure that we do it in the right way. So yeah, really have got an absolute drive and ambition to make sure that it does work well for people.
Yeah, and so thank you. It's been noted, it's just that long last it's been showed through all of the foster panel areas and the children's areas from 16 up to 16, 16, 18 and to 25. Thank you, well done. Thank you.
Okay, in the absence of Councillor Kirby for the moment, and we have no more people wishing to speak as far as I can see in the chat bar, are we prepared to adopt the report and endorse the recommendations? Does anyone disagree? In which case could they make themselves known? Otherwise, I'm presuming we have accepted this report and we will move forward. Thank you. can we now move to the
Councillor Batstone's Fiona
Yep.
here. Sorry, if I could just interrupt. We have a proposal from Councillor Coombs, a seconder of Councillor Alford, but we do need to do the court protector to make a decision on this, as you from the members' minded few decisions.
And I need to know if anyone is not supporting that. And no one has indicated they're not supporting that. Or are you indicating, Fiona, that we should do a formal vote?
I think it would be helpful if we just went round and just got everybody's approval. Okay. It would make it easier for the corporate director, I think, to come to their decision.
In which case, would you like to go through the list of names and get a view? I support for the first one. So, Fiona, would you like to run through the list of names?
Certainly. Councillor Alford.
In favour.
Councillor Barrow.
In favour.
Councillor Coombs.
In favour.
Councillor Ezard. Councillor Holloway. Councillor Jones.
Favour.
Thank you. And we have apologies from Councillor Knox and Councillor Turner, so that's everybody.
Okay, so we have agreed the proposal and we adopt the report and endorse the recommendations with that additional proposal.
If we could just have the corporate director making the formal decision just for the minutes, please.
Thank you, Fiona, and I believe that will be me today deputising for Teresa Levy, who's our Executive Director. Thank you for the support for the paper. Thank you.
Okay. Andrew, have we got you back, or are you still not with us? I've seen support appear. Okay, shall we move forward to the next item, which is the strategy relating to children missing out on education, which I think is something, again, very much a concern for all of us. Who's leading on that one?
Vic Verma on this one.
Thank you, Councillor. Yes, that's me. So happy to provide a short introduction to the report and then happy to take questions after. So our strategy around children missing out on education covers a number of children with different vulnerabilities. It can include children who are fixed term excluded and permanently excluded, but can also include children who are on reduced timetables in alternative provision, or also those children who are electively home educated. And our strategy relating to those children falls into three key areas in particular. So raising the profile of children missing out on education with our partners, and often some of those children are known to multiple services where we can coordinate our information and support both the children and young people and their families, but also bringing in partners where we feel additional support may be needed. Strengthening our data and our close working with schools using our locality model, but also strengthening the line of sight to children in elective home education within our statutory duties, and I'll come on to in a moment a little bit more detail around that. One of the things we set up in the last academic year was a Children Missing Out on Education board, which I chair along with a number of my colleagues, which has a wide attendance from partners including colleagues from social care, SEND, and from the autumn term this will also include attendance from our CAMS service to again bring in that additional layer of multi-agency working. And that's been working very well to give oversight and look at the interventions for particular children where perhaps they've been a bit harder to reach or harder to support to return to education. And I think over the last academic year, we've seen quite a significant reduction in the number of permanent exclusions, which I think has been because of the wraparound support from our inclusion leads, our partnership working with schools and other colleagues really. And just to give you a figure, in 2018 and 19, 102 children were permanently excluded from school in 2018-19. In 2020-21, so the academic year just ended, that went down to 33. Now we know that wasn't a typical year in that there was some school closure owing to COVID at the time, but nonetheless we did see that drive down in permanent exclusions, and there's some specific data. I suppose one area that we were particularly concerned was the permanent exclusion of a a child in reception, and that's highlighted in the report. And that's a particular area of focus for us, despite it being just one child. Reception is not typically a year group we would expect to see any kind of permanent exclusion. In terms of our data gathering, we are undertaking a project over this academic year, which has been running for a period of time, to establish a live link to the attendance data within all of our schools. And what that will mean, the software is called Orchestra, is that we can actually gather all of that information without schools having to submit that to us manually, and start to look at early warning indicators where attendance is dropping, but also get immediate sight of children who are not in education. And that's a major project for us, which will give us a significant amount of intelligence to be able to work with our partners. But that's not to say we don't have it at the moment, we just have it manually, which can lead to a bit of a lag in the data. And then in terms of children who are electively home educated, one of our biggest challenges is that a suitable education, which is what we are required to assess against, that our children are having a suitable education, is not defined in law, and legislation around elective home education is quite broad. Does obviously recognise the right for parents to educate their children at home, but can produce some challenges for us as a local authority in monitoring that education and making sure that those children are receiving a suitable education. And that's really where we're working through our family work service, through our inclusion leads, to work with families and support them in delivering a suitable education, whether that's back in one of our settings or whether that continues to be at home, and balancing that with our safeguarding responsibilities. So at the moment we have 610 children who are electively home educated, and that has seen a slight rise compared to data from previous years, but possibly a slower rate of rise in comparison to neighbouring authorities and national figures that we're seeing, where there has been quite a significant rise. And then obviously we know a number of our children who are home educated have education, health and care plans, and again it's that support that we're providing through the reviewing of their special needs and the provision that they're receiving at home. And of course where we feel that children are missing out on education for untoward reasons, the local authority does have a duty to issue attendance orders or fines, warning notices for families where perhaps that child should be back in education, but that would be through the assessment process and in working with our schools and colleges. So in terms of the report, there are a number of governance boards and activities that our teams deliver in a multi-agency way, so it's not just led by our education service. We work very closely with Sarah Jane's team in social work and the early help teams, and also with our partner agencies in health and other colleagues, including the youth offending service, to ensure that our children missing out on education are closely monitored and there's support in place to bring them back into education. So I'll pause there for any questions.
Okay, thank you very much. Have we any colleagues who wish to comment or ask questions? I would absolutely welcome this report. That many years ago, when there was a thing called Dorset County Council, the committee that I chaired was very concerned, the safeguarding committee was very concerned with this area of responsibility, and that's when we were discussing whether the legislation was going to come through to enable us to have an automatic right to check on what was happening in people's homes. I don't think that died a death, didn't it? Or is it still lurking in the ether somewhere, or was it adapted into other legislation? Do you know?
So my understanding was there was a call for evidence from the Parliamentary Committee in 2018, which hasn't yet culminated in a green paper or a white paper around elective home education. So that's my understanding at the moment, that it's still in that process really. So I think we are still operating on older legislation in terms of no definition of suitable education, and at the moment probably not significant levers for the local authority to automatically monitor education. There's also another point, that there's also not a national register of children who are home educated. So we have, as a local authority, a register that we keep to ensure that we can undertake our safeguarding requirements and monitor education, but that's not a national statutory requirement.
Thank you, and I hand back to Councillor Kirby.
Okay, thank you, Councillor Batstone, for covering for me. It's always a way, isn't it, when you have an important meeting and you get you also have an issue you have to deal with. Thank you, Vic. That's very kind. I've got Councillor Tony Coombs, and then I've got Councillor Stella Jones. Tony.
Yeah, good to have you back. I just really wanted to pick up on the context of COVID. It is mentioned briefly in the report, and I realise that it's early days and you haven't had the full opportunity to assess the impact. But are we seeing any trends with parents deciding to home educate because of the amount of school their children are missing, or are we seeing children drop off the radar? Can you give us just a feel for anything, trends that you're picking up?
I think owing to, so we have seen a slight rise in the number of children who are now home educated. So there is a table on page 10 of the report which sets out that in the last academic year it was 511 children, which would have been the 2019-20 academic year. And then last year that rose by approximately 100 children to 610. That's not been as steep a rise as we've seen in other local authorities nationally, and we've been looking at that data with our partners. And I think that's partly so I think in answer to your question, Councillor, there has been an increase in children who are home educated in Dorset, but we also have good support through our teams working with those families to reintegrate. So there are a number of children who were home educated who've gone back into education, and I think the number would potentially have been higher had those teams not been working very closely with those families to rebuild perhaps their faith in their local school or nearby schools, but also to think about other ways that we can support them, because it's a wider family support that's needed, not just about the child returning to education, to make sure that that child is receiving a suitable education.
Thank you. Right answer. Really impressed. Thank you.
Fab. That's a nice response. Councillor Stella Jones.
Yeah, I'm very pleased to see that permanent exclusions have gone down such a lot, and I'm appalled, like you are, that a child in reception has been excluded. I was a reception teacher for many years, and obviously children arrive at school in many different ways. But to exclude a 4-year-old, 5-year-old child is wrong. Now, can I ask about exclusions from academies? Do we have any influence on trying to make less exclusions from academies? Because I read sometimes they exclude the youngsters for what I would call not the right reasons, such as uniforms, etc. Are we able to influence them?
I think our influence. So, I mean, to come to your first point about the reception age child that was excluded last year, that was something I highlighted and raised with the head teacher of that school, the executive head teacher of that school, which is an academy, interestingly, and but likewise, we look at these children as our Dorset children nonetheless, regardless of whether they're governed by an academy trust. That ultimately, once a child is excluded, it's our responsibility to place them and find them an alternative education. We work very closely with our academy partners, though. We work very closely with our all of our schools maintained and academies. 58% of our schools are academies already. And it's really through those relationships where we are promoting more inclusive practices, looking at things like managed moves, which can be very successful ways of actually finding a new setting for a child and working with the family. And I think that practice is what has reduced the number of permanent exclusions in the county, alongside our schools being able to support our children better. So I think we try not to look at the badge, I suppose, on the school when we are working with them in thinking about exclusions, because our colleagues in localities know their schools, they know their head teachers. We also have our educational psychologists and specialist teachers that will go in and work with schools, both at a strategic level and also with individual children, to think about alternative strategies if some of that's related to behaviour. So I think really it's about, similarly to elective home education. In some ways, it's about that relationship we've built with our schools and how we work with them early when they identify need, so that it doesn't get to the point of permanent exclusion.
Now that sounds really good. Now, can I ask about the 56 youngsters who are still not any provision, the ones who've been out of education? Where are they?
Yes.
What happens to them? Are they just wandering around?
No, so we work very close. So we have our inclusion leads within localities who will work very closely with those families to identify both where they are. So at times that can be families that have left the county or left the country potentially. So we work closely with our partners and schools and our police colleagues to ensure that we know the location of those children. But also they'll work very closely. So we have our Children Missing Out on Education board, which I chair along with my colleague Lisa Lynn Scott, where we will review specific cases to make sure that the interventions that we are taking are resulting in those children returning to education. So that can be looking at alternative provision and thinking about alternative provision while we are trying to find a school setting, but again working with the family to ensure that there is suitable education in place.
The alternative provision is provided by the council, is it?
So it can be either through our learning centres, so potentially that's our maintained Ofsted registered centres. We also have a framework of Ofsted registered providers, and then there are providers that can work with children in a re-engagement fashion. So this can also be where this is the anxiety of a child or a young person being in an educational setting for whatever reason, could be linked to their special educational needs. And we do work with re-engagement providers that help those children, get out of the bedroom and get ready, for school. And it's something that has been exacerbated through COVID. Obviously, anxieties in our children and young people. We know the mental health impact of COVID will be significant both in adults as much as it will be with children.
Thank you.
Thank you for that. Andrew Parry. Councillor Parry, as the Cabinet member, would you like to come in? He's stuck in an RTS.
Thank you, Chairman. Firstly, my grateful thanks to the committee for considering matters relating to children's services today. My apologies for my late arrival. You were given prior notice that I was in another meeting at the start of this, but I'm very glad to be here today. I just wanted to, for a point of clarity on a comment from Councillor Jones there in relation to the number of exclusions from academies. I think really the critical question there, or the point I'd want to make, is we don't want to see a disproportionate increase, because we will see an increase in the number of schools becoming academies. Therefore, we are going to, by factor of that, see an increase in the number of children excluded from academies, but that should not be disproportionate to the overall number of children in the school system. And I think that needs to be something we need to be mindful of. We have a much improved relationship between the academies and a greater understanding of their role in Dorset education. And I know officers have been working incredibly hard to forge really strong links with them. And it's an upside of what's been the terrible business of COVID, that we've actually seen some of those barriers between the local authorities and the academy trust coming down, as we've really understood where each other respectfully can bring engagement and some benefit to children and young people in Dorset. So that's something I'd want to be mindful of. In respect of school exclusions, we do work tirelessly, and it is an area of focus that we do want to see the overall number of pupil exclusions coming down. And we are seeing, and we do encourage things like managed moves between schools, and that's something that has shown great promise. And we need to keep developing those lines of contact so that our children do find themselves in an environment that they feel nurtured and welcomed in and settled, because that's obviously a positive area for learning. In respect of minor infringements and exclusions, which again was something that Councillor Jones touched on, there have been some well-documented examples of that in other local authorities. I noted one in particular which related to a school being quite punitive because pupils arrived with the wrong type of ruler in their pencil case. Thankfully, I haven't had any reports of that in the Dorset area, and I hope we won't. But it's those sorts of things that we don't want to see. But I am also mindful that there have been occasions where, on the appointment of a new head, we have seen a slight blip in the increase in pupil exclusions in a particular school. It has a slight element of the new broom about it when those sorts of things happen. We'd rather that didn't happen in those school settings, and we've got to find a more effective way for heads to be able to state their position and authority over the school without seeing an increase in pupil exclusions, be it either for a set period or a permanent basis.
Sorry, I was on mute. Thank you, Councillor Parry, for that. That's useful. We've got any further questions? No, I think for me, Vic, thank you for the document. I think that there's still the concerns. It's a bit like Groundhog Day, isn't it? We have very little authority as a council to be able to sort of fulfil the work that we're required to do, and I think that's quite frustrating. And I think that part of that is about being able to identify those people. There's not a legal register of people that are required to come through and say whether or not their children are being home educated or not. And I think for me, part of the concern, I've got two things here now, Vic. It's how we identifying those children that aren't in informal education. And I'm thinking from this, like from a safeguarding point of view, what tools are we using in Dorset Council to be able to ensure that that we can find them and ensure that they're safe.
Yeah, in terms of identification, this is our working relationship with schools and identifying children that are no longer attending, and we have a referral process that schools can undertake, which works very well, where they notify us of children who have either stopped attending or parents have notified that they are requesting to home educate their children, and that's really how we work very closely with them to create that register for ourselves, so we can undertake our safeguarding requirements. The digital system I described, which we name Orchestra, I think the company we purchased it from is named Orchestra, is a live link system which plugs into all of schools' information management systems, which gives us live attendance data, so we can start to see trends in a decline in attendance, which means we can early intervene. And schools have a statutory responsibility to notify us where a child that's on their roll is no longer attending. So I think the communication between us and our schools in identifying the cohort is very strong, and means our team can kick into action very quickly once we know that child. So one of the first things our teams do when they are notified of a child is look at whether they are known to other services within the council and whether there's wider support and multi-agency support needed to support that child getting back into education.
Nice, cheers, Vic. And those I was going to say, those families that may move into Dorset with that don't register, I think that's the area of concern there, isn't it? You could have children being home educated, they can move into Dorset, and we just don't have a Scooby-Doo. How will we how will we try and identify those? Sorry, mate, that's a difficult one.
No, it's something we do. We have reciprocal arrangements with our neighbouring local authorities, where we would notify if we feel that or we've been given some kind of intelligence that perhaps they've moved into that particular local authority, and likewise they would notify us. And in particular, we have to enact that where children have, where through our searching we found that a child, or through police intelligence, may have moved to local authority without notifying, and or potentially have left the country. And again, there's multi-agency work needed in some of those very difficult cases where we have to understand what level of support we need to be providing that family. But if a family had moved into another authority, we would of course work with that authority and then notify and hand over, as information in that respect.
Okay, fab. I do have another question, but I'm going to let Councillor Stella Jones come through. Stella.
Following on from that, how do we monitor children who have never been in the education system? Some parents who don't go to preschool or any education whatsoever. How do we become aware of those youngsters?
So again, it comes back to our placing of children, you know, in their first school at reception, and the data that we hold on families. So there's a legal duty on families to register their children for education, and we would use that data to identify.
But there are some families occasionally who don't even register at all, and I don't know how we follow those up at all. Is there any system looking back at births and registration at births?
So I think my colleague Sarah Jane is coming in on that.
There you go. I was going to say, there you go. Pass it across to SJ as the safeguarding lead. There you go, SJ. Do you want to comment? Because I think Stella's along the same lines as me, thinking about like these children that have fallen off the edge.
Yeah. Thank you, Chair, and thank you, Councillor Jones. Really good question. So statutory responsibility for children actually ends with the midwife and health visitor, which we know is a few weeks after children's birth, and then the next time, unless parents choose to engage in services and choose to engage in the health providers, the next time a child should statutorily be known to us is school age. So what's really important for all of us as a safeguarding partnership and for a partnership who work with children is to know who the families are in our area. So we really heavily rely on our health colleagues, and we rely on health colleagues to keep that contact in some way, and obviously it is completely choice for parents as to whether they want to do that. And then if children don't start school at the age of 5, it really is about the multi-agency partnership, being able to have relationships with one another, to have those conversations as to where those children are. So I would really like to give you an answer that says we would confidently know. Children are all registered in the health system, so we know that children are born and we know when they should start school, but there isn't a statutory mechanism to track children into that space. It's very rare that we don't know where children are. As a country, it's very rare, but there are always possibilities. So it really is about local partnerships and sharing information between agencies. So we would keep very alert in that space.
Thank you.
I hope that helps.
Yeah, it does. Thank you.
Yeah, that is good. I think it goes back to the beginning, doesn't it? That with the frustrations around being a local authority, but actually not having the tools to be able to do the work that we're required to do by national government, which is a little bit frustrating. I could say something flippant, but I'll behave. But I think actually is worth perhaps highlighting to I don't know if Councillor Parry wants to come in, but in terms of in terms of a chance to perhaps steer national legislation to ensure that the councils actually have the required tools to be able to ensure that our children are there's a statutory way of being able to ensure that we know which children are in and out of education. I personally would like to see a statutory register of children. So if you have a child that's being home educated, they're required to come through and register with the local authority instead of having a voluntary system as what we do now. And I think the right level of funding as well to be able to ensure that if we do have children that are being, say, home educated, that we're able to ensure that their provision is good. Andrew, sorry, that's always a difficult one, isn't it? And I put you on the spot too.
Okay. Thank you. I know I always like a testing question from you, Chairman, as you know. I think certainly in respect of legislation to enable us to then be able to follow that through at a local level in respect of whether a child is getting a satisfactory level of education in a home setting environment, elective home education. That's something that I think we would all welcome, certainly greater clarity around that, because that has been a source of frustration, not just here in Dorset, but in other local authorities. However, I think you're absolutely right when you bring up the money matter, because inevitably any changes of legislation which are going to require increased service level delivery from the local authority is going to come at a cost. And we already feel great pressure here as a Shire authority in many of the responsibilities we have to undertake regarding the level of funding we receive, or rather the level of funding we don't receive from central government in many of the things that we have to deliver. So I would welcome a greater clarity around the legislation, but I would also caveat that by saying we would want to see central government funding in order to be able to deliver that. It shouldn't be a burden that the council taxpayer of Dorset would be expected to pick up.
I agree. I'm just wondering what we can do as a committee in terms of supporting you in that role. I was thinking perhaps a cheeky joint letter. I mean, I'll take your steer on that, really. What do you think we can do?
If your committee are happy to delegate it to yourself and I to meet after this meeting to discuss a way forward, perhaps with officer engagement, we can then see what would be an effective route, whether we take that through our Dorset MPs or we go another route, perhaps direct to the DFE and the Minister in respect of it. But certainly in so many things around education, we are going to have to see what the steer from government is and the policy setting agenda, and frustratingly a number of times announcements in these areas seem to have been put back, and that sense of frustration has been felt not just here in Dorset, but I know with colleagues across the southwest and conversations I've had with them.
Yeah, I think that is the right thing to do, and I think with the COVID pressures, and I think it's sort of almost come to a bit of a head, hasn't it? If we've got these, more and more families that are taking their children out of education over COVID fears, or aren't returning back to education after COVID. So I'm happy to move to the recommendations now, and then as part of that, if the members would agree, that I can meet up with Councillor Parry and form a letter on behalf of the committee, and we'll do what we see fit to be able to lobby and nobble those with the right authority to be able to get the right results for Dorset. So I'm going to go, because there's no further questions, I'm going to go to the recommendation.
So moved, Chairman.
Sorry, Pauline, Councillor Batstone, go for it.
Yes. Can I move the recommendations as set out, Chairman?
Fantastic. Thank you very much. You've done it for me. I'm just waiting. Do I need to? Let me just have a quick through and try to remember. So it's just purely to recommend that us consider the development of the children's workaround. So there's no actual formal recommendation to be taken apart from the myself and Councillor Parry getting together. So if forming that letter. So if there's nobody else, I'll take that as supported. Fiona, are you happy with that?
Thank you, Chairman. Yes, that's fine.
It's just to consider, isn't it? So
that's fine.
I'll just take that as an action as a result from the meeting.
Thank you.
Fab. And Vic, thank you. I think you're hanging around, aren't you? It's been quite a nice day. It's been like a day of children's services. It's nice to have a bit of a theme. Let's go to item number 8, which is the development of family hubs. And SJ, it's been a bit of the SJ show today as well, because I understand that Claire Shields is away. So it's fallen upon you to introduce the item and to take the awkward questions. So SJ, I think you need a drink later after this. Well, actually, no, leave it to later on this evening, but yeah, knock yourself out.
Thank you very much. Thank you, Chair. As you quite rightly point out, I'm representing my colleague Claire Shields today, and I'm also going to be joined by Amanda Davies, who is our head of locality for Chesil, and Stuart Riddle, head of commissioning. So they're here to help with questions, because what we're really hoping is that this paper is an opportunity for us to share with you our thoughts around the development of family hubs. And as you can see from the paper, this is a great way to work. This is about whole family working, and not just children and their mums and dads, but their nans and granddads, aunts and uncles, the community. And I think if the last 18 months has told us anything, it's actually told us that family and community are really the hub of caring for our children. So what this proposal does is it really brings that into the fore, and you'll see also that nationally this is being given a real drive, and it's also part of our children and young people plan here in Dorset, so it's really timely. I think the visual part of this paper, which is really helpful, if I just refer you to section, I think it's 11.9, and you can see that the family hub, and it's a bit of a concept at the moment, just thinking about, doesn't need to be a physical place, can also be a virtual space. So a place where parents and families can go to either meet one another in person, to get information about any activities that they want for their children, but also, as you'll see from that diagram, some real early intervention preventative work around domestic abuse, around social mobility, really thinking about education and employment training opportunities, just parenting, all kinds of places, all kinds of things that families want to know, need to know to parent their children, and a place where a community can come together. So statutory services within the community, ourselves, health partners, police, but also the great community groups that we know are out there, to come together in localities. So while this is also really good for children's services, as you know, we've started on that journey, and we have our localities embedding, and they have their own energy and momentum, and families know very, very well who's in their locality and where they can get help. So this is really just an extension of that. So what we're really wanting to do today is to share this with you. We've also got, we've been chosen to be a pathfinder for family hubs within the family justice system. So His Honour Judge Dancy from the Bournemouth Courts is very much leading on that work with us, and very supportive of this approach also. So it will lean really nicely into that, and thinking about that work, it's really thinking about families where they're maybe thinking about separation or divorce, and how mediation happens at the earliest possible point, how we can really think about parental conflict, and how we can make sure we're alongside parents to help them through that, to make sure that the experience that their children have is as informative and as supportive as possible in those very difficult circumstances. So these family hubs can really reach into many places and spaces. So what we wanted to do today was have an opportunity to really bring this to you for discussion, to help us inform really our next steps. And the recommendation would be hopefully for you to support us in the development of the family hubs. Thank you, Chair.
Thank you, SJ. And don't tell Claire this, but I think you're doing a better job than she's doing.
I don't think that's possible.
Oh, there you go. It's all right. It's because she's not here. I can get away with it. I've got Councillor Ryan Holloway.
Good morning, Chair. And apologies for a little bit late this morning. Just wanted to say, this certainly do welcome this coming to the committee. This I think this will be a very good another way, I think, of networking. I shall use that term, for young people and families, as well, as you said, Sarah, to obviously to help mediate and obviously catch things, you know, to sort of at an early stage, which I think is good. Just have one question, I do, just regarding about the, where it says on the report about the implications. It says that we're still waiting an announcement from the DFE about, obviously, about the bid for the funding of this. Have we had any confirmation from that? And also, are we as a council, are we contributing towards any of these projects?
Thank you, Councillor Holloway. I'm going to bring in Stuart Riddle, who's our head of commissioning, who'll be able to give the best answer to that question. He'll have the detail.
Yes, it's a simple answer. We haven't heard yet.
Stuart, have we got any indication from the DFE as to how long that could take?
Forgive me, I'm just checking my mail here because, yeah, no, we haven't, and it's always a frustrating time waiting for the outcome of bids, because usually they have to go past the minister, and depending on how busy things are, you can get some delay there. So we'll make sure that we publish it when we do hear, one way or another, just so that colleagues and members are aware of how we did on the bid.
Thanks, Stuart.
Here you go. Thanks. Cheers, Stuart. Thanks for that. Sorry, my Teams is playing up slightly. I've done people in a slightly different order. I've got, I'm going to do it in, so I've got Stella Jones, Tony Orford, I've done Ryan, then Councillor Taylor, then Molly Rennie. So Councillor Stella Jones.
Yeah, I think this is a brilliant way forward to have family hubs, and I think it's important just to have one integrated front door, which we've started doing already, and develop locally led parent support services. And it's interesting that you mentioned talking about divorce, helping in that as well for parents and young children. And I've just been reading a very important, interesting document called the Early Years Commission. It's just been published in July, and it's a brilliant document. I would hope everybody can get to read it. And down there, they are also supporting hubs. But one of the things they are supporting is that birth hubs should become birth registration centres as well. So a parent goes to a hub, registers a birth, looks if there are more information, more support services there. And actually, they're there once. And going back to the last item, the birth registration would be there in the hub, and we could follow them all the way through their life. So hopefully, I hope you do manage to get this document to read. It really is worth reading, and it supports everything we want to do.
Thank you, Councillor Jones. We'll make sure that that document is circulated for those people who haven't read it as yet. It's a good read and very supportive of this approach as well. So thank you.
That's a good point, Stella. Stella, you're on point today. Fab. I'm going to go to Councillor Tony Alford.
And thank you. Just a short question, really. I'm interested in these concepts of digital front door and digital service delivery. And it led me to start wondering to what extent there are models like this already in existence. But then you said that we're talking about pathfinding. So it sounds from that side here that we may be exploring something that's rather new, and we don't know very much yet about how it will work.
Yeah, that's a very welcome question. And I wonder if I could just bring Amanda Davies in, who'll be able to give detail around the exploration of the digital front door, so to speak, and also how we can use that. And I think the pathfinding bit very much is around the connection between, just why Amanda's bringing herself to us, is very much around the family hubs which are connected to the courts. So the work around mediation that I started to talk to you about, that is very new. And it is, I think it's an excellent way to work, but we will be sort of finding our way through those approaches really, and seeing how we can build that into our family hub approach. So very much pathfinding in that way. And as a national pathfinder, we've been asked to share the results with everybody else, so that they can see what we're doing and help to inform their services too. I'm hoping Amanda will be there.
I'm here.
Brilliant. Thank you, Amanda.
You're welcome, Sarah Jane. Yes, so digital service means all sorts of things, and it means both, virtually access to services, information, advice and guidance, but that digital access can lead to actual access as well. So COVID in a way has enabled us to test this slightly, because I think one of the things you were talking about was how tested is it? So, for example, with our parenting support model that we offer through our early help teams in the council, during COVID and during lockdown, parents still received parenting support and online, and for some parents that was, you know, through a digital platform. So for some parents that was more suitable, and it meant they had swifter access. They weren't waiting on a course in their area, for example, because we could reach more people across Dorset. So there's one example of where it's kind of been tested. Going back to, we've been obviously looking at our children's centre provision for many years, but haven't really been decisive about our children's centre provision. I think it's fair to say in Dorset, and we know that we feel that part of family hub of our children's centre offer and the best elements of that. When we asked parents, when we were last looking at our children's centres and reviewing, we said, where do you go for help? And almost overwhelmingly, of course, our families were saying, actually, we Google, we digitally seek help. So we know that overwhelmingly, not in all cases, but in many cases, that's where families go. And when we've spoken to young people as part of our recent work and our takeover days, for example, young people say, please don't assume we always use digital, because we do like face-to-face interaction and we do welcome emotionally available adults in our lives, but it's often our first port of call. So I think our role as a local authority is to bring out the best of our learning from COVID and how digital services have helped. Look at other models of public access to services digitally. You know, how many of us access services digitally now as, you know, as a matter of course, but also really think through with our communities and alongside. I would love to design family hubs with our families and listen to them about actually how do you currently access services, what would be meaningful to you. So at what point actually does face-to-face matter, and how do we then as a local authority, as a partnership, you know, our health colleagues, how do we respond to that in rural communities? It is quite complex, but I think as I say, most of us access support digitally now, and it's a case of kind of really thinking that through with our families as we design these family hubs. I hope that makes sense.
Well, the answer is it does make sense, and not only was it very helpful, it makes me think that much of what you said applies to a lot of council services.
Absolutely. Yeah, absolutely.
Nicely said, Amanda. Looking forward to the sort of co-collaboration, especially with children and young people. I have Councillor David Taylor.
Yeah, thank you, Chair, and thank you all for letting me speak again. Overall, your picture of family courts and things on page 79 with your grid and various bubbles around. There's two elements I can see there which is missing of actually communication, and you've already nearly addressed this actually within community issues. That's in the people who sit on the various boards, family selection, children selections, foster selection, adult services, but also the fact of the police. Now, the fact is, I have mentioned this before, is the fact is that are we having communication with the police, as in together, to making sure that the safeguarding measures are implemented all the way through? And I say this as an overall concern, as to say, where is this being delivered from? Who is this delivering this complete operation? Because at the end of the day, it entails all of the areas to come together, and that will be the key question, to say, who is actually monitoring this, and are we getting all the facts?
Councillor Taylor, if I could start with the safeguarding response to your question, and then Amanda will come in to talk wider about community policing, I think.
Thank you.
From a safeguarding perspective, we are very much working with our police colleagues through our front door. So we have a multi-agency safeguarding hub that's well embedded, and a conversation starts immediately. If we have a concern raised about a child, we're very much in that conversation with partners, and we have some really strong relationships in that space as well. So I feel confident that we are talking to police colleagues, they're right alongside us, and particularly thinking opportunity to talk about our harbour approach for our children in care. We have embedded police colleagues within the team, which is just paying huge dividends really to the support that we can offer for our young people. So we know that that works well. We have a really good relationship with our local police colleagues. Amanda, I wonder if you would just like to say a bit more about how our local policing will reach into the family hubs as well. Thank you.
With pleasure. And I was really privileged to lead children's centres in North Dorset some years ago, and it's made me think of, you know, the response to the digital question. So I led a number of children's centres, including Blandford, which many of you may know is a big site. Now that was a great model, and it happened to be a physical entity, and the professionals who joined us in that space were numerous, depending on family need and depending what families help, you know, the help they were requiring. And that included the police, and in really strong children's centre models across the, you know, across England and the nation. That's the case. So that there's a physical presence by community partners, which what makes family hubs really tick is relationships.
Yep.
And trust with our residents in those, if you like, authority bodies. So our community policing teams in Blandford were often present and played a really strong role, for example, in staying safe online with families, running courses with our parents to help their children stay safe online. That was a really key feature of our work. Gillingham was another children's centre I ran, which didn't have a building, got really good Ofsted outcomes as a children's centre in Dorset, you know, and outstanding for partnerships. And so we didn't have a physical space, but we still had that presence and connection with our families from our police colleagues, from our health colleagues, and from our, you know, our own social care staff, so that our families knew where to come and who to speak to. And it's those relationships that are key. So absolutely, I think it's really imperative that in developing family hubs, this isn't just a Dorset Council conversation. Yeah, this has to go to the whole locality model. So the way our localities are developing, and certainly in Chesil, our police are alongside us daily. They're literally in the office. So I hope that kind of reassures you. It will be a joint endeavour.
Yeah, and also can I interject the fact is that what we pick up from foster selection panels and adult panels, etc., is it being looked at and being referred back to the relevant people to sort out if there are any problems, because we sometimes don't hear this. Okay. And if we don't hear it, we don't know what's going on. And that's what really concerns us, to say who is actually dealing with this. We've actually picked it, identified it, something's wrong or something right, and therefore how are we actually making sure that it's followed through. And the final bit of my question was, with response to who is actually delivering this all over, is it a joint partnership, or is it some group, or is it a membership team? It's very difficult to know who to go to actually get that answer. Thank you.
Amanda, do you want to come back in on that, or are you done?
I think I'm pondering the question, so I think I'm done, but I think it is something we need to, no, it's fine. I think it is something we need to think about, absolutely, and make sure there is a feedback loop, absolutely.
That's why I mentioned it before of this, actually, in the last children's meetings we've had, and it seems to be, it's there, but it's never really acted upon. So we've got the facts, the information, and it just seems to stop somewhere. And that's the problem we have, is that we identify things that are wrong, and is it being dealt with? And if it is being dealt with, so we know that is it being dealt with, so then in the future, if we discover it again, we go forward and actually make sure it's being dealt with by the right people.
That's no problem. I think we can take that away, my colleagues and I, as an action to think about those feedback loops, making sure you hear back when you've raised concerns.
Thank you. And the final question, I'm sorry to repeat it the third time, who is actually delivering support? And that would be the key question for me, to say, who can we actually speak to as a group? No? Okay.
Yeah. Go. That's a valid question, David.
I'm sorry, put you in a call there. Okay, well, thank you anyway.
That's fine. SJ, do you just want to answer before I go to Councillor Parry? I think David has asked a good question. Who's actually going to deliver on this? Because I can see that there's quite a few voluntary groups as well that may want to get stuck in and involved, and you know and I think that would be really useful when we come to our cross collaboration. We come to form this. So Amanda, absolutely. I'll give you a break. I'll go to SJ and then I'll let Councillor Parry in.
Thank you very much, Councillor Kirby. So the delivery of this will really, as a local authority, we're doing that, the discovery phase, if you like. So in that conversation with partners, with other agencies, and Stuart and Amanda and their teams will bring together a stakeholder group, if you like, which won't just be Dorset Council. It will be most importantly our children and families, of course, but partners as well. And then we'll be delivering that through what I'm going to assume is a very clear governance. So definitely what Claire was hoping for today was to bring this paper to you to kind of get some ideas, to socialise it, and the next steps will be to really firm up a very clear governance, ways that we can come back and just update you, touch base really about how things are going, get further thoughts and ideas, because what I'm really hoping is this kind of work will really generate a lot of discussion in the community, in our communities, and through our local groups, and it should be that everybody is talking about this everywhere, and that we'll get really good feedback from that as well.
Fantastic, thank you.
We're going to Councillor Parry. Thank you, SJ, for that. Come on, Andrew.
Thank you, Chairman. It's just in response to the points that Councillor Taylor was raising with us there, and you know, as recently as yesterday, for example, I was very grateful to have the opportunity to have a meeting with the new Police and Crime Commissioner, David Sidwick, and I found it a very refreshing political conversation for us to be able to have, and his encouragement, and to be fair to him, he'd clearly done his background work and his knowledge, because he did speak very warmly about the Harbour project and other initiatives taking place across the Dorset area. What I would say, where we have partners who have pan-Dorset responsibilities, the police are one, the CCG ICS is going to clearly be another. There's often quite a focus in the BCP area in relation to the delivery of service. It's very much our cause to bang the drum to make sure that they understand that the needs in the Dorset Council area do have to be met, and they have to step up and play their fullest part in the delivery of that. And I very much got the sense that you know, in the case of the police, David understood that. His new chief constable has a very clear mandate as well in delivering on those responsibilities as well. So many positive things to say, but clearly we mustn't ever let up on the demands that we ask and seek from our partners who have pan-Dorset responsibilities, that we here in the Dorset Council area do get our fair share of their service delivery as well.
Good point, nicely made. I'm going to go to Councillor Molly Rennie, MBE. Very formal.
Thank you very much. I don't know why you keep saying that, but that's kind of
It's
you.
because it highlights the fact that you did a good job, Molly.
Thank you. Can I just say how pleased I am to hear so much support for this. This journey through the court process can be traumatic, dire, non-productive, upsetting. Why would I ever do this to myself and my family? So many of these comments you hear, and I've been privileged to be part of Judge Dancy in this journey to bring this forward. I have to say, there are so many. I'm not talking just about DA, but there are so many partners involved in taking care of the whole family, and the court systems has seemed to be left out of it for quite a long time. And Judge Dancy's come forward with this new initiative, of which we are a pilot for it, and we should be welcoming this and grabbing it with open arms, which it sounds like everybody is. It's been really interesting to hear different partners' comments during the meetings there's been about this, and this lack of understanding about in court and how it affects the parents. Even if you are a splitting parent, you care about the other person, how it affects people leaving domestic abuse relationships, why it's important that a child who's on a contact visit is not returned late. A simple little thing like that. And the work that we've done as well with the domestic abuse toolkit as a council is a really good tool to be able to use to help people who are within this journey, about making things very clear for people about how you take care of people with families. So I just want to say thank you. It's so much has come about from shared learning, and And I just thank Judge Dancy for allowing the forum to be involved with it and sharing the knowledge of so many members of the forum. So it's good to hear you. I think you're moving towards adopting this, so I'm very pleased. That's it.
Thanks, Molly. I've got Councillor Stella Jones and I've got Councillor Tony Coombs. And then I think we'll wrap this part up. So Stella, Councillor Jones.
No, you've already had me. I was only once, yeah. I will say more if you want, but I don't want to prolong the meeting.
That's very honest.
It is a good idea, and I hope we do approve it.
Oh, there we go. Thank you, Stella. There you go. It's all good stuff coming through today. Tony Coombs.
Thank you, Chairman. How does one follow Molly at any time? Very, very difficult. She does a grand job. I wanted to just pick up on our existing children's centres and how this new arrangement will work, because obviously I have a local centre where I am, and as a local member I'm quite concerned about what the future will be for that and how it will fit in with the new family hubs. But also on a very positive note, we have our own youth worker now in the area, and she is liaising and working really well with her previous colleagues in children's services, and it's really good to see that link with the voluntary and community sector is really strong now.
That's really good to hear, Councillor Coombs, and I'm really happy to come in about your question about children's centres, and it is a question mark we really want to answer, and I know many of you on the call probably hear from your residents about children's centres. So I think the answer is that family hubs are the best elements of children's centres writ large. It's our opportunity to really grab hold of the best work that children's centres have achieved and make it work even more and even better, and thinking whole family. And I think our really good children's centres in Dorset did that. They thought whole family. What this does, it gives that national kind of the national driver. There are some local authorities who've already created family hubs thinking of their existing children's centre model and making best of it. So we know that there's opportunities for learning from others with this. So I hope that helps and reassures you. I think, again, going back to my point about working with our families and with our communities, that is a really crucial piece of work. So, you know, how do they access support? Where do they access support? What support actually already exists in that community, so that we don't duplicate effort and we don't come in, you know, with a shiny hub, whether that's virtual or actual, and get in the way of some really, really good work that's already happening. So it's a question we all have, and we really want to answer, and we want to be a bit more decisive, I think is my response to you. I hope that helps.
It's encouraging, because obviously we don't want to every time reinvent the wheel, and to pick up on the best of what worked before and improve it is, for me, the way forward. So thank you very much.
You're welcome.
There we go. Oh, fab. Tony, good question, because I think I was only going to mention about the duplication and working with what's already there, and I think that has been nicely answered. So yeah, I think that's quite an accolade. I think you've only had positive comments there. I think we just need to manage the message very carefully about the fact that, you know, that it's more than just younger years now, but it will still be supporting those younger years, but actually improving and increasing the service. Okay, all right. So I'm happy to move on. The recommendation is just to comment, and I think we've done a good job of commenting there. It's only need to go on to the committee's forward plan and cabinet's forward plan. Now, I mentioned it earlier. I'm not going to put the Saunage ambulance car on the forward plan until there is until the consultation is released by the CCG. Is there anything else that members may like to consider or have any comments on? If not, then we can finish a whole 5 minutes. I've got an RTS. Who's this? I've got Ryan Holloway. Ryan, you look dashing today as well. I like the glasses.
Oh, thank you, Chair.
No, it's
unfortunately, yeah. Obviously, as I said, apologies for being a little bit, a little bit late this morning. My meetings have been clashing everywhere. Just sorry, going back to about the ambulance car again, as you said. Do we have any knowledge of when the CCG is supposed to be starting any of that consultation at all? Because as you know, Chair, we've had quite a lot of emails in regards to that. Obviously, obviously I know this is not in my ward, but obviously I'm the neighbouring ward, and obviously if there are changes, of course, that could possibly have impacts on the local community. So, do we actually have any confirmation from CCG?
I tell you what, I have. I know we did touch on it earlier, but I'm happy to go back to it just for clarity. I've got Councillor Laura Miller. There we go. It saves me having to repeat myself. Laura can say it this time.
Thanks, Chair, and thank you, Councillor Holloway. I think, I mean, as somebody who represents a ward in Purbeck, I'm perhaps a little closer to this, than just my cabinet portfolio. I think what we need to do in this situation is very, very emotive. I took my son out for fish and chips in Swanage the other day, and there are posters everywhere. There are signs everywhere. Swanage, historically, because it's on a peninsula, can sometimes feel quite isolated. I used to work there, and I think, you can feel quite isolated in Swanage. So we can't underestimate the strength of feeling. However, I'm in constant contact with colleagues at the CCG. I have stressed to them the importance, and they know, they're aware of the public interest in this. As soon as anything happens, we will know through me. We can then go, okay, how are we going to respond? How are we going to look at this? Let's take this very sensibly, very carefully, and let's listen to our residents. I don't have a time frame yet, but all I would say is that we need to be very careful of how we look at this. We need to be very, very sure that services provided by our health colleagues, because the decision is not in the gift of Dorset Council, and it is not for us to criticise another organisation's consultation. But we may wish to respond because we're acting on behalf of our residents. We need to be very sure that all the services across Dorset are equitable and equitably available to all residents. No one is left behind. So really, in short, not yet, but as soon as I know, we'll all know. Is that helpful?
Yeah, it is, and Councillor Holloway, just to reiterate that what we'll do is we'll I think with in collaboration with the portfolio holder, is that we'll look at either having a small working group or a task and finish group or something. Again, it depends on what the consultation is, how long it's out there for. I think what we don't want to do is speculate or be accused of predetermining decisions. So I think hopefully we'll put that to bed for a bit.
I appreciate what both of you are saying there, Councillor Miller and Chair, for that. No, I do appreciate, obviously, but as you know, obviously, this, it's something that we've got to keep a very close eye on. We have, obviously, we know, as you said, all we can do is, because obviously it's a different organisation as well that's making that, but obviously, we can, obviously, as you said, we can respond to it, because we do, obviously, because whatever implemental changes they make will of course have impact on all our residents and of course the neighbouring Purbeck wards, as you said as well, Councillor Miller. But no, I take your notes, and then obviously I appreciate that that we just need to keep our eye on that ball. Thank you.
Yeah, I think it's very much kept an eye on, and I think we'll await the CCG to formally contact us. But I'm sure, Ryan, that my inbox will overflow with emails as soon as the consultation goes live as well. Again, just highlighting the strength of feeling. Go on there, Laura.
Sorry, just really quickly. We're working so closely together with the development of the integrated care system that we will find out about this stuff very easily and very quickly. It's not a question of they'll just contact us. We're in constant working together, so we won't miss the boat on this.
There we go. I was going to say from the horse's mouth, but you'll probably punch me later. All right. If there's no further comments on the forward plan, we'll wrap that up. And I've got there's no God's with me my words today. You can tell I'm not 100%. There's no outstanding business and there's no other items, so I'll bring the meeting to a close. It's 11:58, and I'm going to go and do the day job, and I go and stick in some broadband to rural residents, and I'll see you on the Fiona. What's the next date? When are we next getting together? The 18th.
I'm just checking for you.
18th.
9th of November is the next overview meeting.
9th of November, and we've got 1 or 2 bits and pieces to look forward to. I think we're going to have a lot of Jane that day. There we go. Jane Somper's leading on some the care leader offer. Fab. Okay, all right. It's good to see you all. Hopefully, we'll see you in person next time. If not, keep safe, and I'll see you all soon. Cheers for your help.
Thanks, Chairman. Bye.
Thanks, many officers who did good today.
Bye-bye.
SJ especially, go and get yourself a gin and tonic.